Welcome back. We are answering your questions about the coronavirus with Cone Health's family medicine physician, Dr. Zoe Stallings. Remember, you can text your questions, the number right there on the corner of your screen. All right, let's answer this question. A lot of hospitals are changing their visitor policies. What is Cone Health doing?
So at Cone Health, we are limiting visitors during this time, very similar to what we've done during flu season. If you are in labor, you get to have a support person with you. If you are a child, or if you're an adult who needs someone to consent for you, such as if you have dementia or behavioral changes or memory changes. But other than that, we really have to limit how many people come into the hospital because you can bring the virus in or you can leave sick. So our goal is to limit contact and protecting the staff and patients who are there. So it is just the same policy that they've had in flu season. It's just applied now during the coronavirus season.
This person is asking, if you wear glasses, is there a way to not get them to fog up when you're wearing a mask?
That is something we deal with every single day. It will fog up because of the warmth of your breath, but some people have taped the top of the mask down. So if you tape it down, that can help. People have bought these fogless masks. I'm not sure what technology that is, but a simple and cheap way is just to use a little bit of tape. Fabric tape is better, like if that one that feels like cloth instead of something like duct tape or cellophane. You don't want to peel your skin, but if you tape that down, it creates a little barrier and some of that steam won't hit the glasses.
Good tip there. Every day I see more people testing positive, but do all those positive tests mean people are also showing symptoms?
No, many people who are tested, sometimes they're tested because they might be a frontline or a healthcare worker, or they have been in contact with someone. So we are still testing people who have been exposed, who may be asymptomatic. So your exposure level needs to be high, such as a household contact, somebody who lives in your house who's tested, somebody who you may have shared a trip with who's now sick. So we are still testing people even if they have no symptoms. But there are also symptoms that we ignore, such as a lack of taste. Often we ignore that one as a symptom. Some people might get stomach pains and we assume that it's from the food we ate. So sometimes the symptoms are actually missed. But depending on your contact, we will still test you. Cone has numerous sites. You would go online and go to conehealth.com to see where you would go for testing.
So someone is asking, is it safe to go to a community pool with all of this?
Community pools are beginning to open up. And so as some of the Ys, the YMCA is opening up their pools as well. And what they're beginning to do at some of the community pools is to limit how many people can be in the space. It's not the issue of the water because the water has chlorine, it's treated. It's the issue of you using the bathroom, you touching the surfaces, you sharing the towels, all those other things you do at the pool that makes it risky. If you were to get out of the pool and to spit on the ground, we are always seeing people who might choke and cough and spit in the pool area. So it really is that we can't always assure you that it's being properly cleaned. So limiting how many people at the pool will be important. You can do that yourself. If you get there and you see that the pool is crowded, just go home, try another day.
This person is asking, is it safe to attend the wake of a person who has died from coronavirus?
So I would say it depends on how many people are there. Theoretically, we're supposed to limit the wakes to 10 individuals, I believe. Many times that explodes. Sometimes people want to be able to share that moment with their loved ones. They want to support each other. And it's not the person who has passed, it's not the person in the casket, it is the other people who are alive that are the risk to you. So my recommendation would be, if there is a wake, sometimes people do a staggered time. You can go half an hour and then the family's there to greet people and they may have to maintain some social distancing. Some people are doing wakes by Zoom. It is just important that you remember it's not the person who has passed that's the threat, it's the person who's alive and breathing.
Understood. Okay, this next text question says, should we be wiping down all of our groceries before we take them inside our homes?
So I often see people do that. That's a very labor intensive thing to do. So my recommendation would be, if you are buying canned items, just go ahead and you can quickly wipe those down with just a regular wipe. It doesn't have to be a Clorox wipe, a bleach wipe. You just want to wipe off the dust off the top of the surface. When you open your can, that way the dust and debris is gone, and that's a standard thing to do. But your fruits and veggies you're going to wash anyway, And your meat products, when you cook those, the heat will kill any viruses. So bacteria and viruses are something that we often with food handling recommend that you use high heat to kill. But in terms of you taking out each item and washing and wiping them down, that's a lot to do. So I just recommend cleaning the top of the can before you open it, washing your hands after you handle meat products, and washing your fruits and vegetable with a little salt water.
With a little salt water.
Yes.
Okay.
That's
How-
just a little gardening thing.
Okay, with a little bit of salt water, and that is
With
better
salt
than
water.
washing it with soap or something of that nature.
Yes, you don't need to use soap. The reason you use a little salt water, if there are any ants or little bugs on your vegetables, the salt water will just rinse that off. But appropriately, you don't really need to use soap. There are chemicals in the soap, and you're not going to consume that. There are some vegetable wash at the grocery store in the veggie section that you can use, but salt water would be just fine.
Okay. This person is asking something that many people have been asking because it is summertime. If you're planning to go to the beach, should you wear a mask while you're there?
So at the beach, while you're on the sand, in the water, away from others, you're fine. Keep your mask with you because you might need to use a porta potty. You might need to go buy a snow cone or some ice cream. Wherever people congregate, that's where the threat should, we see that we are at the beach and we can choose where we sit. We can keep our beach towel and layout away from the person next to us. However, when we go to use the bathroom, when we're bunched up at the boardwalk, when we go to buy cotton candy, that's where the threat is. And so at the beach, especially crowded beaches, you want to make sure that you keep your mask on as you're interacting with the public.
Okay, and that is a very easy delineation. At the beach with your family, no mask needed. When you're standing in line and that kind of thing with other people, that is when you need the mask.
Definitely.
And
Keep the
bring
mask
that
in
baggie.
and bring your baggie.
To put the
Absolutely.
mask in. Okay.